although there's been a lot of progress with tribal communities in India, they still lag behind very much in many different indicators, and in particular when it comes to food security and malnutrition. So we're going to hear more now from Rajeshri. Why is it important to focus on the nutrition and food security of tribal communities?
In terms of nutrition and food security, scheduled tribes face challenges like heavy dependence on subsistence agriculture, lack of access to health and hygiene, limited access to social safety net, and low awareness. Apart from that, deforestation, climate change, and loss of commons have also impacted the food diversity and consumption. For example, many tribal women don't have access to sufficient nutritious food. That leads to poor health and serious consequences. If you look at NFHS data, the latest ones, 25.3% of these tribal women are suffering from malnutrition. I think therefore it becomes important to address the gap and explicitly focus on the needs and challenges of these scheduled tribes so that India can achieve its SDG commitments.
What has the WFP study found in terms of critical insights?
World Food Programme conducted a comprehensive study in partnership with Government of Odisha to understand and evaluate the food security and nutrition status of tribal population in Odisha. Around 1,908 tribal households were taken as sample from 19 categories of scheduled tribes across 8 districts of the state, out of which 1/3 represented PBTG households. More than half of the population have been affected by climate change, which is leading to loss of livelihood. The data also indicates that 1/4 of the scheduled tribe populations are food insecure, and this is even higher among the PBTGs.
What is the state government doing through policy to support tribal communities, and how is WFP supporting them?
See, there are a number of state and central government schemes to address the food and nutrition issues of tribal households. For example, all food-based social safety nets include tribal communities. Additionally, Odisha government has a number of schemes specifically made for scheduled tribes households to look after their irrigation issues, their health and sanitation issues and concerns. Another thing that I would like to highlight is that women empowerment is one of the critical mandate of Odisha government. There is a department called Mission Shakti, Department of Mission Shakti, that is dedicated to the cause of women. There are around 6 lakh self-help groups comprising of 70 lakh women that has been formed by this department. World Food Programme is providing technical support to this department. One of our key findings indicate that SHG participation is much lower than expected among these PBTG households. In light of this and drawing relevance from our collaboration with Mission Shakti, World Food Programme has launched a pilot intervention in Kankadahat block in Dhenkanal districts, basically to provide technical support to these SHGs, these PBTG SHGs, so that we enhance their livelihood and their food security is enhanced, and also we are also focusing on the women empowerment aspect.